Hello, welcome to this week's Down But Not Out podcast. Today we've got Jane Lambert on talking all things autism, ADHD and how parents can best support their young people.
Good evening to you and welcome to the Down But Not Out podcast here on MKFM with Arthur Ellis, the online mental health charity, joined by the beautiful, handsome and lovely with white legs
Very white legs.
Very white legs. It's a sunny day on the day we're recording this, and John Manning from Arthur Ellis has got his white legs out.
For one day a year.
I didn't even notice.
Didn't you?
No, I'm gonna come
You
and
can't
look
see
in a
their
minute.
glow.
I'm coming to have a look in a minute.
Yeah, it's because they're translucent. That's why you can't see them.
And we've got our wonderful guest Jane, who's already noticed John's legs and is paralysed by everything you can see. But today's podcast is not actually about John's legs. What are we talking about today with the wonderful Jane, John?
Neurodiversity. So, Jane, I'll let you introduce yourself, but we've known each other for a few years now. You've been on the show before when it was in a different form, but you've got experience of neurodiversity from a variety of different aspects, so I thought it'd be great to have you on and find out a little bit more.
Lovely, thank you. Thanks for having me. Yeah, I do have experience with neurodiversity. So my background is that I'm a nurse. I'm still a qualified nurse. And I want to say it was about 11 years ago now, I adopted 3 girls, all siblings, and for years had difficulties in working out what was different, why they were struggling, why I was struggling to parent them. And it took me a long time to realise that actually it's because they were neurodivergent. So 3 of them have ADHD, 2 of them also have autism.
So you've been through the whole journey with them. They didn't sort of, you didn't adopt them with, you know, knowing that they had
diagnosis,
special educational needs or anything like that.
No, absolutely. I adopted them quite young, and in the adoption world a lot is put down to trauma, which is true. They have been through trauma.
Okay.
But that's not to say that you can't have neurodivergent conditions like ADHD and autism as well. And actually in the care system we know that there's a high percentage of children that do have ADHD, autism, just as 2 examples. So through years of my own discovery and working out and getting them diagnosed, what I actually struggled with was to find the right support for them. NHS wouldn't touch them because they didn't match the criteria, and even if they did, I don't think I was prepared to wait the length of time for an NHS waiting list, which obviously is even worse now to get an assessment.
Yeah, I was going to say, when was this? Because you said 11 years ago, right? So how long did it take until you started to recognise things and go for those assessments?
So I started actually with my youngest when she was 7 and she's 14 now.
Okay.
And anyone that knows her, you know, she very clearly has ADHD and autism, but she didn't meet the criteria to get on the NHS waiting list.
When you say criteria, what does that criteria look like, Jane? Because, like you say, if someone's obvious to, you know, to even to an untrained eye, like you say, if people just know her, what is that criteria if they're not able to see that? Just so we understand.
So in the NHS, and actually as part of NICE guidelines, which are guidelines that we follow in healthcare, they have to be seen to have difficulties in 2 settings.
Okay.
Now those 2 settings are often home and school, being the 2 obvious settings.
Right, okay.
Now we know that a lot of children mask at school because they're mindful, they're aware, and they feel self-conscious about the difficulties that they have. So as a result, they mask, they try and hide those things, which is exhausting for children, but as a result, sometimes school settings don't see it.
Right, okay.
So they get so good at covering it
They
up.
get so good at covering it up. And the other thing is that sometimes the lack of education within schools about neurodiversity, because you could very easily put some of the behaviours down to just poor behaviour.
Okay, right, okay.
Rather than actually they might be emotionally dysregulated, they might be sensory overloaded. A lot of people just put that down as bad behaviour. And in my case, with my children, some of those things were put down as bad behaviour.
Okay. And so with the teachers, that's 7 years ago, has that improved through your knowledge, like with the schools and stuff like that since 7 years ago? Are teachers more aware of it nowadays?
They are.
Right, okay,
They are
right, which is great.
Yeah, they are much more aware of it. The difficulty that we have still in a lot of our families that come to us at Make Well Clinic is that schools still don't see it. So yes, in terms of their behaviours,
yes,
they're better at recognising it without doubt.
Yeah.
But in terms of masking, it's actually really difficult for teachers to be able to identify children who are masking because they don't necessarily know what they're like at home.
Okay.
And a real classic scenario is that a child will go to school, mask all day, which, if you're not being your normal self, could be exhausting.
So as you said, it is exhausting.
It can be exhausting.
Game face at work as an adult is hard enough, you know.
Well, exactly.
Yeah, no, I know
exactly.
Okay.
And then what happens classically is then that child comes home and we hear the parents say they have an absolute meltdown at home because home is their safe place.
All bottled up.
They've been bottling it all up, and it's almost like a shaking up a sort of a can of Coke. They get home, you open up the lid, and then the parent gets that overwhelm, the meltdown, and quite often the parents don't understand why either.
Yeah.
So it's this disparity between what schools sometimes see and then what the parents see at home.
Yeah, because we've talked about the teachers and the adults in schools, but what about other students? Because I think over the last couple of years, the amount that are on a waiting list on the NHS has increased by, I think it's 82%. So a lot of those being adults, but a lot of those being young people as well. Do you feel like young people in the new generation are a lot more clued up than adults that are in the schools?
Sometimes I think it probably depends on what their parents' views are and how their parents see it. So certainly I'm chair of governors at a primary school. We're not a SEND school, but because we're in a small village, we get a lot of SEND children. Because with the very reason that I would send, and I did send my children to a small primary school because it's much more family focused, if you like. There's less, there aren't so many adults for them to get to know. There's not as many children in
Time is less shared.
School. Exactly, and so as a result of that, the teachers are a lot more clued up, and then actually also the children almost like normalise it. That's just what they see. Yeah. Whereas again, if you're in perhaps a big secondary school, the children, their peers, may see it as bad behaviour.
Yeah.
So again, it depends, I think, on what their personal experience and lived experience is. And we do find as well then some parents don't, and this is awful, but it's true, some parents don't want their children in the class with some of those SEND children because they worry that it's going to affect their child's education or their child's behaviour.
I've heard that with parents that are concerned with and saying there are a lot of guys that are, they are needing more attention from the teacher, that they are worried about their education.
Yeah.
There's no fair to anybody in this situation.
There's no right or wrong. I
there
absolutely understand everybody's needs, and that's the difficulty. And I think that's the difficulty schools face, especially mainstream schools, trying to accommodate everybody's needs and be fair to all the children.
Yeah. And then,
so they all get what they need.
And then I suppose any segregation within that, where you take these guys need a little bit of extra help, then do they get ostracised from the rest of the class? Is it, so they again? Well, if you could sort that one out, Jane, that'd be great. Thanks ever so much, because that's tricky, isn't it?
From a mental health perspective, generally, if someone's got neurodiversity, or they're diagnosed with, I suppose, arguably we all have because it's a spectrum, right?
Yeah.
But if someone's diagnosed and they go down a support route for that condition or those conditions, generally mental health isn't taken into account with that. It's kind of seen as a very separate thing. So if it comes along with anxiety or low mood or different things, then that's not necessarily treated alongside the neurodiversity. It's kind of left.
Really? Yeah. I'm really surprised by that.
Different departments.
I didn't know. Because I would have thought that nowadays you would have gone, right, well, this probably leads to this or this. The connections aren't there.
No.
I'm really surprised.
Not in our traditional systems, unfortunately not. And even the very basic, like for example, if you wanted to have an NHS assessment for ADHD or autism, you would have to go to 2 different departments, 2 separate waiting lists, and we know that a lot of people have both.
I was going to say, and I know it's not black and white, and as you said, John, on the spectrum, so there's various different levels of these, of different things, but I would have thought, as a layman, as I often give my view of this, I'm such a layman with this stuff, I would have thought that would have just made logical sense, that you're on a waiting list for, but when you said about the waiting list earlier on, I thought you meant, oh right, they go to an appointment, but then they would be able to be looked at for ADHD, autism, all at the same time. They're separate.
No, they're separate. I know it's insane.
That's insane.
And this is one of the things that drove me and my passion to set up Makewell, because one of the things we offer is a combined assessment.
Yeah. Why wouldn't you?
Because as a parent, how do you know whether it's ADHD or autism? Because there's so many things that do overlap. And as we know, a lot of people will have both. That's much more of a holistic approach. Yeah, but as John said, with the mental health, we see a lot of older children, young adults who have been on antidepressants for years that haven't necessarily made much difference because they've been treated for that anxiety or that depression, where actually, yes, it's a byproduct potentially of their ADHD, but it's the ADHD medication or coaching or strategies that are going to make the biggest difference.
Wow.
And so we've managed to get a lot of people off their antidepressants because they're on the wrong medication.
For the wrong thing, because you're treating the symptom rather than...
Absolutely.
Fabulous.
You even mentioned about the some of the issues related to being overstimulated and those sorts of things, and again, that's going to fuel anxiety, it's going to fuel your mood, so all of these things are so interconnected.
So interconnected, yeah.
Right, well, we're going to take a little break there, Jane, because my mind's already been blown, which is, you know, it literally happens every week. I can't, honestly, my mind's blown. We'll come back for more with the lovely Jane and John and his beautiful white legs. That's coming up. So welcome back to the Down But Not Out podcast with John and Jane. Oh, it sounds a bit like a kids' programme now.
Oh, John and Jane.
John and Jane.
Cute.
Oh,
That's
no.
cute.
John and Jane, they live down the road. They're ever so nice. They always have biscuits. Lovely.
We skip down the road.
Of course you do. Of course
I'm going to show my age, but there was one, Rosie and Jim.
Oh,
we need a narrowboat. I think it was on a narrowboat.
It was,
did you
it was
see
a
you?
narrowboat.
To setting up a new business on a narrowboat. So we were talking about neurodivergency in kids and the diagnosis of it. My mind's been blown that actually when you go to your appointment to talk about the diagnosis of autism and ADHD, you have to do it separately, because why wouldn't you do them together? That's crazy. So we talked a little bit about that, and I know that's all the questions.
And some of the mental health issues that come along with it also aren't part of that support level mechanism. So we, in our one-to-one service, we see a lot of SEND children, but we work with them on the wellbeing side or mental health strategies, things like that, because obviously they're going to be anxious, they're going to have all of these things going on, because ultimately they're growing up kids at the same time. So all of those typical issues they're going to be experiencing on top of everything else. So we rightfully said about being overstimulated, the behavioural issues. So I wanted to ask you, Jane, how does that come out? Because rather than recognising them as behavioural issues, maybe we can help people to understand why these are happening. So what kind of behavioural things do people generally see? So
if we start with at home, because as we've already sort of talked about, sometimes at home and at school can look very different.
Because of that safety element.
Absolutely. So hopefully, it's difficult as a parent if you've got potentially challenging behaviour at home to see that as a compliment, but it is because your child feels safe with you.
Yeah.
So it's a compliment. I know that's difficult when you're in the moment and you're dealing with it.
There are certain compliments you don't want in life sometimes.
But it's their safe place. So they can unmask and they can be themselves. So behaviours that you could see, and it varies sometimes between ADHD, autism, but also every single child and adult is different. So one child with ADHD could present very differently to another child with ADHD. But as you quite rightly said, John, the majority of them will also have issues with their mental health. So potentially with anxiety is a big one, and depression, but anxiety is definitely something that often goes with it. So some of the behaviours that you might see at home might be, as we've already said, the meltdown after school. And what that can look like is they might walk into the door in the house, throw off their shoes, as a normal child might do, who's neurotypical, should I say, and then you see them explode. This might look like they start screaming and shouting. They could flop themselves on the floor and kind of have what we call like a paddy, a traditional paddy. But it's often because they're so overwhelmed that with a neurotypical child, you can often then negotiate with them, talk to them. But in the moment, with a child who's neurodivergent having a meltdown, there's nothing you could say or do that's going to change in that moment. You have to almost ride the journey with them. So the important thing to do then is to keep them safe and just be present. And what a lot of these children do is really feed off your energy. So it would be very easy as a parent, if you're exhausted thinking, I've had a full day at work, now picked you up, now you're exploding, to actually start to escalate yourself.
Yeah.
And it's really difficult to keep calm. And I always think about it as a bit of a swan. So on the outside, this is textbook stuff, on the outside you show your child that
Graceful,
they're safe,
lovely.
you're calm, and hopefully that you can help de-escalate their overwhelm.
Yeah.
Inside you might not feel that, but this is the trick, is to be calm on the outside. Otherwise you end up with this vicious cycle and you just both escalate each other.
That must take time in itself to
It takes time,
gain control over.
but it also takes really, really good understanding, but a lot of self-discipline
Yeah,
as
there
well
must
to
be.
do that. And I think once you start to understand your child's needs better, you parent actually in quite a different way. So I've had lots and lots of people say to me over the years, you need to be stricter with your children.
Right.
Because a neurotypical child, you might be able to say, go to your room, that's not okay. And they'll go to their room.
Yeah.
With a child potentially with ADHD or autism, they might just stand there and look at you.
Right.
And that might be processing, that they've not really understood what you've said or
Yeah.
why. That's sort of poor communication skills. It might be that they're scared. Lots of reasons why they might not just go. And then if you end up escalating yourself, because it's that battle of the kind of the wills in a way. And I think sometimes with children with ADHD especially, they're dopamine seeking often, because we know that they don't have enough dopamine.
And dopamine's like a reward.
Exactly,
processing.
makes them feel better.
Yeah.
So dopamine doesn't always come in positive ways. We try and advocate for that because that's a really good strategy to use for ADHD.
Right.
But if you have a parent shouting back at you, that can actually be a dopamine fix.
Oh, really?
Yeah.
Wow.
Because of attention.
Because of attention.
Yeah.
It might not be good attention, but you're still getting attention.
Right. Okay.
So sometimes when you're dealing with a child who is neurodivergent, if you are giving them the reaction that they're looking for, which is shouting back, you're feeding into that.
Yeah.
And one of the things I've learned over the years, which is really difficult, is just if they're in that moment, sometimes it's easy just to walk away, as long as it's safe for them, where you leave them, to walk away and allow them to calm themselves down.
Yeah.
And that's the time that you can come back and talk about something.
It's interesting.
I'm just confused and a bit in awe, because we're talking about managing this with one young person, and you've got 3. So how do you manage when you're juggling different things to keep one young person safe, and then obviously there's other 2 that are just sort of present and being, so you can't forget about them either. So
It's a complete nightmare.
yeah.
I like the honesty, Jane.
I think we need to acknowledge that, because that's hard.
Yeah.
That's near on impossible.
It's a complete nightmare. So now my eldest 2 don't live with me.
Right.
So that is easier.
Well, that is one answer. Now, to make this clear, they're old enough now that they're living elsewhere.
That's right.
Until they move
Yes.
out.
But when they were all younger and we're all living at home, this was the problem, because when you're talking about emotional regulation, for example, if you've got 3 neurodivergent children who are all dysregulated, potentially for different reasons in different ways, they're going to dysregulate each other.
I was going to say, do they have a knock-on effect?
100%.
Yeah.
And we also know that neurodivergence runs in families. So actually, if you are a parent of, say, 2 or 3 children, you may have more than one child who's neurodivergent. And then the cherry on top is that
Keep going.
it's likely to come from one of the parents,
Who they are
because it runs through families. So at this stage, one of the parents probably doesn't necessarily know that they may well be neurodivergent. So if you potentially have ADHD, let's say 2 of your children have ADHD, you might unknowingly struggle with your own emotional regulation.
Right. Okay. Yeah.
And you're now trying to
Regulate
manage somebody else's. So, and this is where we see a lot of families end up in crisis point, because things feel out of control, and people don't have the skills and the knowledge to know what to do.
Yeah.
When it comes to those skills and knowledge, obviously you're a practitioner, you know, with your medical background and stuff like that. But did anybody go, right, Jane, this is how you deal with it? Now, picture a swan. But you now know how to do Is there training for someone who potentially has, once that diagnosis has happened, you say, right, as a parent, you are going to need to know these skills and know this. Is there training in that, or is it no, just figure it out? How does that work?
A bit of both.
Okay.
A bit of both. There's a lot of resources.
Okay.
There's some great charity websites that I always kind of push people to. One is the National Autistic Society.
Mm-hmm.
One is ADHD UK.
Mm-hmm.
We have a really good local charity called Autism Early Support. They deal with autism and ADHD, but they have a parent portal that's got loads of different resources on. So a lot of it is doing a little bit of your own homework to find out what issues you're having within the family, and therefore what bit of resource or strategies you can start to use. One of the things they do often do well in the NHS is that they often put families or parents through what's called a parenting programme.
Oh, okay.
And I went on a parenting programme
Okay.
in the very early days. They often do that before they will diagnose or assess your child.
Right.
I believe one of the problems with that is that it has a really negative effect on parents. I don't know how to change this, but it's almost like suggesting, and I felt the same, that you're not a good enough parent. So come along and we'll teach you how to parent your child properly, and that might help. If it helps, then we might not need to assess your child.
Right.
But
Oh, wow,
actually
that's
the
a really
programme
nice,
is amazing, because
Right.
what it does teach you is how to adapt your parenting. So it's
Okay.
trying to get that the culture change,
Yeah.
that actually parents, and a lot of parents say to me, how dare they suggest I do parenting programme, was now,
Yeah.
I'm on this stage of my journey, it's like, I get it, because actually, if you understand a lot of the simple, but the ways you adapt your parenting,
It
life
can
at home can be a lot better for
Yeah.
you all.
It does make sense that,
Yeah.
and bless, I'm not a parent myself, but all of my mates are, and sometimes they'll be stressed, and why are they doing this, why are they doing this, and they're trying their absolute best.
Absolutely.
But as far as I understand, there isn't mass lessons for parents. You've become a parent, right, send you to school. No, you figure it out yourself. So you've tried your best, and for somebody to go, well, are you doing it right? You go, well, I don't know if I'm doing it right. So I can understand why they get defensive about it, but so important
Yeah.
to modify how you do it, because that could be a massive change.
Yeah.
Fabulous. Right, Jane, stay there. We've got more questions for you. Go back to the Down But Not Out podcast for the final part of the podcast. What you don't realise in the break, we were talking about fake tats. That was what.
Oh no, we're talking about my white legs.
And how I've given you the solution.
Yeah. We got talking of solutions. This is the part of the show where we cover a variety of solutions. So far we've spoken about an introduction to your lovely self, Jane. Parenting with neurodivergent children. Would you consider yourself a carer? I don't know whether that is fair, because I guess technically you are, but would you consider yourself one?
Yeah.
Would you?
I would, and do you know what I worry about, and I know other neurodivergent parents are the same, is when I'm no longer here, who's going to be the
What
advocate for my
happens?
children? Because obviously in your traditional family setting, you prepare your children to be independent, thriving adults, don't you? That's what we all want for our children. And my girls, even especially my elder two, are now adults in effect by age. They still need a lot of support, and I'm not sure if they'll ever live independently.
So what's that like to sort of be thinking about that so early and having to consider all of these things? Because I can imagine parents of neurotypical children don't necessarily, they'll think about, what's it going to be like when their kids grow up, but they will probably be looking forward to them having that independence.
Yeah.
So what's that like to think that way and to have to prepare for that?
You have to be quite practical. So I've recently redone my will, for example, because again, this is quite morbid, isn't it? But it's
important.
Let's see,
reality.
we talk about John's legs up in this.
But I've just redone my will. So, again, if I was to go, then my children wouldn't be able to cope with managing getting a load of money. Not that I'm rich, I'm not saying that.
No.
But
No, we know what you mean,
do you know what I mean? They wouldn't be able to manage that.
No.
So I have to put that in trust so that actually they are well looked after.
Yeah.
But I know that there has to be some in-between support and help to do that. And I think it's about being practical. So again, like my elder two daughters have got a good support team around them now.
Okay.
So what I try and do is take myself kind of off the caring role as much as I can, especially when they reach adulthood, so that I can just be mum. but that
Yeah,
actually
lovely.
those support systems are in place.
I was going to say,
For them.
is there a bit of a checklist for someone who's a parent carer, as you are, and that you go, right, at some point try and think about a will, think about the future, is there advice, is that part of, you said about some of the portals that are there for parents of neurodivergent children, is that advice out there to go, look, at some point, get this in line, because your life then becomes less stressful, I presume. You know what I mean? That you go, right, I've sorted that out, and you're forward planning, which is better for your own mental health as well, dare I say. Is there advice out there for that? Not a checklist, maybe, but...
Not necessarily a checklist, I think, but also the important thing to say is that a lot of neurodivergent children will grow up to live independent lives. So I think it really depends on the needs of your child, because actually we know, and one of the things that we do at work, or I try and do especially, is reduce the stigma of employing neurodivergent people, because there are actually so many strengths. So
it's very low, isn't it?
It's very low. Like the number of autistic people that actually are in employment is ridiculously low. Off the top of my head, I think it's something like 5 or 10%. It's absolutely shocking. But actually, you know, in Makewell, we have quite a high proportion of neurodivergent employees, and in the right role, with the right support, they could absolutely excel. So back to your question, then it depends on your child's needs, I think, but something to think about if you're worried about them going into adulthood.
If you're talking about adjustments as an employer, what kind of things do you mean? What supports people? I know everyone's an individual, and that's going to really vary, but could you give us some examples of?
Yeah, and a lot of the things you can do at work are either free or really quite cheap. So actually, as an employer, you don't necessarily have to invest that much. Part of it is obviously understanding and creating a psychologically safe culture so that people can talk about it. Because we know, I think the stats are something like less than 30% of people will tell their employer that they're neurodivergent. And that a lot of that is down to the stigma, or perceived stigma, that they'll be judged for that or criticised for that. But some of the things that we do, so for example, if the environment's too overstimulating, we might give them headphones so it quietens down the noise. Some of the offices have the lights low or off because it's too bright and too overstimulating for them. And these are all based on kind of
simple things.
I'm not being funny, but just simple conversations with staff of like, you know, what would make it easier for you. And that's the key thing. What would make it easier for you to work?
And it doesn't really have an impact on anyone else, does it?
No.
It doesn't change things.
So our clinicians office and our senior leadership team office, we've just recently bought standing desks. So you can sit or you can stand, and actually just simple things like having that movement, they really enjoy. Doing that really helps. Every single member of our team, neurodivergent or not, has a fidget toy.
Oh, really?
On their desk. Because we just, you know, you don't have to be necessarily labelled as neurodivergent. You know, if you're on a stressful call, let's say, you've got a little fidget, it just helps you to focus or to relax. And so, there's lots of little things, like you say, it's not big. And actually, in our Bradwell offices, in our beautiful site, people can get up and go for a walk. We have an allotment on site, so people go and spend 10 minutes digging and
all of this is so important for well-being. We've done a bananas and donuts show before, and Jane, I don't know if you've come across our bananas and donuts.
I have, I know all about your donuts and bananas.
Yes, well, you guys actually support the Send area of our summer festival, which is all about bananas and donuts. So bananas are moving, so physical exercise. So that's one of the things that you've mentioned that as an employer you're encouraging through the allotments and everything else. Focus, so those fidget toys. Discover, which is learning anything new, which kind of happens at work, you know, as and when. And also learning about other people and other conditions or different things that people might struggle with. Communicate is that sense of belonging and humans around you, and pets, which I'm sure you probably have in the office sometimes.
We have a therapy dog.
Yes.
And we have 5 therapy horses. The horses are not in the office, but then next to the office, just to stimulate that.
Just to make that absolutely red rum, I'm going to call it. Winnie at me.
And then finally, it's help, so supporting others, and you know that could be accepting somebody's need for an adjustment. You know.
Absolutely.
So there's so many things about well-being that are positive around making adjustments for everyone, which is an incredible thing that you're employing within your organisation?
Do you know what I always think is really interesting? When you've talked about it in your two different workplaces where you're obviously massively aware of these things, but even if you said just in workplaces in general, for years, well certainly for the last 10, 15 years, people have been more aware of plants in workplaces and these, and we've started to do that for everybody. So this is not, when you're talking about changes for employers, this isn't a big change.
No.
It's just a next little thought. By the way, you've done this, the lights, could we do some, you know what I mean? It's part of a checklist, almost, that you go, okay, we've just dug slightly deeper, and now we're doing this. So it's not this huge, change that needs to happen in workplaces across the country. It's just a couple more little things. And I've just said, quite often, when I do radio shows, I always used to like the lights a bit lower, it was a bit calmer, it was, so, I have never been diagnosed with anything. Whether I do, I don't know. But what I would say is just nicer. It's just a nicer environment. So all we're asking for are minor changes that everybody would benefit from, which is interesting.
Yeah, exactly. And I think one of the key things is talk to your team.
Of course.
Talk to people. What helps. And actually, if people are given that opportunity, they might come forward with some really simple things that make a big difference. Yeah,
and like you say, the distraction. The distraction. So the reason I laugh is I'm often one of the distractions in an open plan office. They would ask me to, they would shoot me. No, actually, all right, you two, all right. But the headphones on and stuff like that, and it's really, really interesting. We didn't have a horse though, so you know what I mean. I will see if we can work on that.
I've met your horses as well. They're beautiful.
They are adorable.
Tell us a little bit more about the charity though, Jane, because obviously you've told us a little bit about the horses and the dog and the environment. How do people find out more about the charity?
So we're not a charity, we're a private business. No, that's fine. We're a private business, but the business, or the clinic's called Makewell Clinic. We're based in Milton Keynes in Bradwell Abbey. So people can come to us for private ADHD, autism, or as we've already said, combined assessments. We also do mental health assessments, therapy, and support services, because we've never wanted to be a diagnose and discharge service, because for us, getting a diagnosis is the start of a journey, not the end of a journey. And almost every parent that I've spoken to who's had an assessment and a diagnosis for their child, their very first thing is, now what?
Of course.
Now what? So I've got that information. What do I do with that information? How can it help me? How can it help my child? So we want to be the answer to people's now what? As well as helping them to understand what's going on, so they can understand their child better. Their child can understand themselves better.
Does that process, is that over, I mean, it's very hard to go, well, it's over 6 months and then that's it, or is that an ongoing until they don't need the support anymore? How does that go?
It's ongoing. I mean, absolutely. We are private, so obviously it is a paid for service. Having said that, we do a lot of free stuff for our local community here. So we go into local schools for free, and we'll talk to parents, we'll talk to teachers, so that we can give them some of these helpful little tips that we've been talking about today. We do free send parent support groups, so we're just trying to help people with information, just again, simple things that you can do at home, like we've talked about at work, that actually can make a big difference. So we're always there, even if it's just to signpost people to other areas. Services. People can always access us.
And that's why, from my own perspective and the journey that I've been on, making assessments and things like that so easy to access is really important. Like you said, as soon as you get that diagnosis, that's when the hard work starts. That's when you've got to learn about things, you've got to maybe understand different medications, go through some therapy or whatever. So the fact that these assessments are so difficult to come across on the NHS or on these public services, people already are exhausted by the time it comes to actually do that work. So thanks for being around.
Thanks for being
You're welcome.
And thank you for the advice on the fake tan, John. I think you would take that. That's a takeaway for you.
Clarins. There are other products available.
Jane, wonderful to have you in. Thank you so much. If people want to access you, find you, what's the name of the website? Just give us
wemakewell.co.uk.
Wonderful. Thank you very much. Thank you to John. Thank you to Jane.
Thanks, guys.
That was the Down But Not Out podcast, but you're very welcome.